How is high monocyte count diagnosed and treated?
Hello everyone. Today we're going to explore an important aspect of your blood health, the monocyte count. Specifically, we'll discuss how high monocyte counts are diagnosed and treated. The health of your blood is crucial to your overall health and well-being, and monocytes, a type of white blood cell, play a significant role in that.
What are monocytes?
First, let's start with the basics. Monocytes are a type of white blood cell that plays a crucial role in your body's immune response. They help fight off infections and assist in the healing process when you have a wound. A high monocyte count, known as monocytosis, can be a sign of an underlying health condition.
How is high monocyte count diagnosed?
Diagnosing a high monocyte count usually involves a standard complete blood count, CBC, test, which is a common test that evaluates the cells in your blood. This test gives a count of your red and white blood cells, including monocytes. A high monocyte count is typically considered to be above 0.8 times 10 to the 9 per liter, but this can vary based on the lab and individual health factors. It's also important to remember that monocyte levels can fluctuate throughout the day, and a single high reading doesn't necessarily mean there's a serious health problem. However, consistently high levels should be evaluated by a healthcare professional.
What can cause a high monocyte count?
Various conditions can cause a high monocyte count. These include 1. Infections, such as viral or bacterial infections. 2. Autoimmune diseases, like rheumatoid arthritis or lupus. 3. Chronic inflammatory conditions, such as inflammatory bowel disease. 4. Blood disorders, like leukemia. 5. Recovery phase after an infection or surgery.
How is high monocyte count treated?
The treatment for high monocyte count largely depends on the underlying cause. If the increase in monocytes is due to an infection, antibiotics or antiviral medication may be prescribed. If it's related to an autoimmune condition, treatment might involve medications to manage the immune response. In the case of blood disorders, such as leukemia, more complex treatments like chemotherapy, radiation therapy, or even a bone marrow transplant may be required. If the high monocyte count is due to the recovery phase after an infection or surgery, no specific treatment may be needed as the count will normalize with time. Remember, it's crucial to treat the underlying condition causing the high monocyte count, rather than simply trying to lower the monocyte count itself. So there you have it. A high monocyte count is typically diagnosed through a complete blood count test, and treatment depends on addressing the underlying cause. As always, if you're concerned about your health, it's important to consult with a healthcare provider. They can provide guidance based on your specific circumstances and health history. Thanks for joining us, and we hope you found this information useful. Stay healthy.